The Valley Private Hospital is nearly 30 years old. It started as a small private hospital, and it sort of developed slowly over a long period of time. In the last 2.5, 3 years, the decision was made to invest heavily in the Valley Private in particular, to develop it into a major high acuity private hospital. $30 million was invested to redevelop the whole hospital, to invest in new technologies, to expand the hospital with new theatres, new beds, and also importantly to develop new technologies that would take the hospital forward into the future, where it was in a position to provide a far greater service. We're looking forward to develop the hospital from currently 150 beds, 7 theatres, 1 hybrid theatre, 1 cath lab, into 300 beds, 15 theatres, 2 to 3 cath labs, as the major provider for southeastern Victoria. We chose the Mackay Hybrid OR because we wanted something that was unique and the best in the world. And we sent 2 of our staff to an international conference where the Mackay Siemens Hybrid OR was being demonstrated. So once our representatives came back, reported on how exciting this opportunity was, and we engaged with Mackay and Siemens and the opportunity to have the first integrated system in the world, we were very excited about what opportunity that would deliver. And as it transpired, and we were very soon to learn, it wasn't just the ability to do cardiology, operating, and have that flexibility in a hybrid environment. It was the vastly superior ability to deliver a neurosurgical capability that was unsurpassed anywhere in the world. So we had that ability to be flexible and attract more complex cardiology procedures, interventional procedures, knowing that we had the ability to provide a cardiac surgical backup immediately without moving the patient. That gave us a unique advantage over any other hospital in Melbourne. In orthopaedics and neurosurgery, and when I talk about neurosurgery for the moment, I'll mainly talk about spinal and cervical, we had an ability to complement the ability of the hybrid theatre, which had the intraoperative imaging, with the Nobel Prize-winning technology from France, a low-dose, weight-bearing imaging system where surgeons could get precise measurements from the EOS system and 3D recreations of the spine, the hips, the knees, etc., that they could then take into the operating theatre, in this case into the hybrid theatre, where they could maintain intraoperative imaging and get that specificity of measurements and so forth that would enable them to get the best possible outcomes for the patients. So, you know, if you're looking for safety, security, quality, the best outcomes, I think we're quickly developing and now developed that ability to provide you with the best outcomes that are possible.